There was one case where someone said, "Why do you think I'm diabetic?" And they looked at it. They said, "There's a doctor that keeps saying you're diabetic." But then the data people got in here and said, this person is not taking any diabetes medicines. And they see other doctors, but the other doctors don't say anything about diabetes. So then it turned into this discussion with our client on a conference call. And they said, "Okay, this case here, what are you seeing?" Well, we see. And then it dawned on us looking at the data. We said, they never really say they have diabetes. They say they have diabetes symptoms or in their feet, that's a code. You can put it in there. I said, but nobody else is saying this. At which point they said, "What was the doctor number again?" We gave them the doctor and they said, "Okay, that's a doctor it's a podiatrist. They cannot get paid unless the person has diabetes." So now they're lying about it. Then it turned into a different kind of search. How many cases do we have where there's a diagnosis of diabetes has occurred because of a continuing code being presented, but there's no other diabetic indication of care at all? It turned out to be there were 13 other doctors that were in the same boat. And so that was a case of finding what would be constituted as medical fraud. That if a doctor was putting a code in order to get certain payments, and if they didn't put a code like that in, they couldn't get paid, then they were gaming the system.